was just talking to a patient today about her autoimmune conditions and her chronic pain. And what was really interesting is that it was discovered at her most recent other doctor visit that she is battling Lyme. And it was confirmed. So there's that. And the question became, well, how much of the chronic pain and the conditions that she has and the symptoms that she has, how much of that could actually be created by like Lyme as well as parasites? And I don't know if you've heard of humans having parasites, but it is a thing. And yeah, they do. And it is kind of gross, yes. But um, recently I had several patients who experienced purging parasites, and then they had certain symptoms that had plagued them for many years go away. Whether that was chronic pain or sugar addictions or even too much cravings for things like drinking alcohol. So it's fascinating and not discussed quite enough the role that can be played by parasites, but also things that are like parasites, parasitic in nature, like Lyme. The Western test for Lyme is very archaic, outdated, simplistic, whereas there's many strands of tick-borne pathogens that can be tested on what's considered out-of-pocket testing that you have to pay out of pocket to receive. And yet, those are the tests that are actually telling us the truth about whether a patient actually has Lyme and whether it's chronic Lyme or is it recent, is it activated, or is it more dormant? And that kind of gives information on how to treat it. So if you're battling really chronic conditions, this might be something to consider, especially if you're from certain areas of the country. But listen, ticks are everywhere. Grass or not, they're like, prevalent, very prevalent. So some food for thought, so to speak. And if you have questions, reach out.